think the excitement is that we have patients who now are increasingly understanding and aware of the options they have, which I think is tremendously important, because that provides patients with choices. They know they have options, and they can be truly a partner at the table in deciding, what's best for them in terms of treatment. Now, I think we're very fortunate that we have options, but we also must be fair to our patients and recognize that we mustn't sort of dazzle them with too many choices and leave them confused without guidance. So I think that becomes a real dynamic that requires, on the one hand, patients obviously to have an understanding of their disease and know as much as they reasonably can about the treatment options. But the flip side of that is that essential relationship that's about trust between a provider and the patient, to allow decisions to be made in which, our job as the provider is to synthesize information and be our best advocate for our patient in making choices. And that's very difficult for a patient to make in isolation. They have to, I think, reasonably have the ability to rely on their provider to be able to make sense of all that's in front of them. But I think the positive message, Charlie, is really straightforward in that regard, that in the old days where it was sort of one size fits all, and if you were a certain age you get a transplant, and if you weren't you couldn't, and you just take what's out there on the menu, as it were, that clearly has changed completely. And I think what we're sitting in now is an era of what I'd call tailored medicine, where we can sit down with our patients and say, you have these features of your disease, this is you as a person, and these are your needs, and these are the potential other challenges you might meet because of other comorbidities perhaps. So we would recommend these kinds of choices as probably a best combo for you. Now, that may sound simple, and wow, well, why wouldn't everybody have that? The truth is, only a few years ago, we were far more limited in what we could offer patients. So I think the fact we can do that now is fantastic news for our patients, actually.